It is my pleasure to speak with Dr. Sadie Currye today. She is the first African American woman gastroenterologist in our country. She trained here at Duke as the first African American and the first woman trainee here at Duke. She's a distinguished professor and has been an inspiration to me in my career. And I'm pleased to talk with her today about her career, her upbringing in North Carolina, education, and her time here at Duke. Dr. Currye, thank you for coming to speak with us today and to inspire our new generation of trainees.
Thank you for inviting me. I must say that I was very surprised, and I've told several people that I've known you since you were a medical student. Not that that was so long ago, but it lets them know that we go way back. And I must say that I was quite surprised when you called to invite me down, and this is really an honor. And some of the things that you said about being the first female and so forth trainee here, I wasn't quite sure about that, but I've subsequently found that that is true. Mm-hmm. And I have to thank Dr. Mike McLeod and Dr. Tyre for giving me the GI fellowship when I first came down to Duke to do GI.
So tell us about your early years here as a native North Carolinian, your education, and the time before you got here.
Well, I'm originally from North Carolina. My hometown is a little place called Reedsville, which is near Greensboro. It's 20 miles north of Greensboro and 20 miles south of Danville, Virginia. Great metropolis with a population of 15,000. But that's where I grew up, and I went to public schools there, and upon finishing high school, I attended Johnson C. Smith University in Charlotte, North Carolina. Johnson C. Smith is a Presbyterian school, and I had an older brother who had gone there, and a few years later my sister went there, so I was very familiar with Johnson C. Smith. That within itself was quite an education, because Johnson C. Smith used to be an all-male school, and my brother went there because one of the principals at our elementary school had gone to Johnson C. Smith. So he was a Johnson C. Smith alum, and he convinced my brother to go there. At the time that this principal was there, Johnson C. Smith was an all-male school. And when we went there, obviously they had started to accept females, but rules for girls were very stringent. We had a curfew. We had to be in by 8 o'clock. We could not leave campus without permission from the dormitory matron, and dormitory matrons always had quite a reputation of being very strict. Even if we wanted to go to the church down the street, we had to get permission to leave campus for anything. Johnson C. Smith, being a Presbyterian school, required religion. So we had to take religion the first year, the Old Testament. We took religion the second year, which was the New Testament. The second year I always found very interesting because there was a comparison and contrast among the world religions. And I always found that very interesting. Even now I find it very interesting to read about the various religions. So I always found that very interesting. We were required to go to chapel Monday, Wednesday, and Friday, and we had to go to church every Sunday. And we had a certain number of cuts, but if a student exceeded those cuts, they would actually put them out of school. So they were serious about chapel and church. So that was Johnson C. Smith University with its Presbyterian heritage. But I found it a very interesting experience. And I recently went back to the 50-year reunion for my class. And at that reunion, it was very nice. They had gold caps and gowns for us to march. It was at commencement. And marching in, as we were going down the aisle, we could hear some of the students talking as we were going down the aisle. And one of the female students said, "That's the 50-year class." And the young lady next to her said, "What do you mean the 50-year class?" And she said, "They graduated 50 years ago." And this young man standing with them, he said, "You mean they've been out of college for 50 years?" And she said, "Yes, that's why they call them the 50-year class." And he said, "And look at them, they're walking." So we were all, as we went by, trying not to laugh at their comments, but that was a very nice experience, and we were really appreciative of the way that they had gone out to honor the 50-year class.
Sounds like you were well prepared for medical school.
I think so. My brother had gone to Howard University Medical School, and he had, at that time, you know, when you finished medical school, you didn't have to do a residency to go into private practice. So he had gone into private practice in a little town called Statesville, North Carolina, and he was the only African-American doctor there, but then he was drafted to go to Vietnam, so that's when he left Statesville. And then drafted, when he returned, he was at Fort Bragg, and he met Dr. Stead. Dr. Stead used to go down to Fort Bragg and make rounds. Dr. Stead was a very impressive person. I'm sure you all know. It's like Dr. Stead was Duke University. And that was how my brother ended up getting into the cardiology division at Duke, and he did his cardiology there, and he went to Howard University. Well, when I finished college, I applied to Howard, and at that, you know, many people these days, I've heard medical students say they apply to 15 schools. Well, you have to send money with all these applications. I applied to 2. I applied to Howard University, and one was Medical College of Pennsylvania. So I was accepted at both, but I decided to go to Howard, which was, I thought, a great experience.
And how did you end up coming here to Duke as an intern for your training in medicine and GI?
Well, after I finished medical school at Howard, there was a professor there, Dr. Walter Lester Henry, who was outstanding. He was an endocrinologist, but to this day I have not met anybody that I think knows more medicine than Dr. Henry. And the thing that we enjoyed about him was the ease with which he taught. He never tried to embarrass students. Even when they had done something wrong, it's like he had a way of correcting them without making them feel stupid. So everybody loved making rounds with Dr. Henry. And at that time, we even had some attendants who came from the National Institute of Health. And they would, when Dr. Henry was making rounds, even people that were not on his team would come to get in on the end of Dr. Henry's rounds so they could hear his teachings, because he was just great with patient care and pointing out things. So one of the NIH attendants had said to me once, "I learned so much." Now, this was a man who had trained in the Ivy League schools, but he said, "I learned so much when I make rounds with Dr. Henry," because he would come up at the end of the rounds, almost like sneaking up, so that he could round with Dr. Henry. Well, Dr. Henry was invited down here to Duke as a visiting professor, and I had never seen an African American visiting professor at Duke the whole time that I had been here. And Dr. Henry gave the grand rounds. He made rounds with the staff. They were all so impressed. At that time, the chief of medicine was Dr. James Weingarten. You remember Dr. Weingarten?
Oh, yes.
He was the chief of medicine, and they were all just so impressed with Dr. Henry. But it gave me the opportunity to reintroduce myself to Dr. Henry, and it turns out that he only had one person at Howard in gastroenterology. And so he said if I had an interest, that he would be interested in having me join the faculty. So I had come down here to Duke, and I completed my GI. And with my talk with Dr. Henry, I applied for a position at Howard, and that's how I ended up going back to D.C. after I finished my training down here. And of course, there were many experiences at Howard as a medical student that were still prominent in my mind, because as medical students, we rotated, as Howard University medical students, we rotated, of course, at Freedman's Hospital, because Howard University Hospital had not been built at the time. So we rotated at Freedman's Hospital. We also rotated at Walter Reed, and we rotated at DC General Hospital. Now, at that time, DC General was one of the 10 largest hospitals in the country. I think Bellevue had the largest public hospital, and Los Angeles, I believe, was number 2, and Cook County in Chicago was number 3. But DC General was in the top 10. And as rotating at DC General, that was an experience that I think all of the students really appreciated. And the one rotation that I thought was most outstanding was when we rotated on OBGYN, because back at that time, abortions were illegal. Roe v. Wade had not come about, it came about shortly afterwards. But we would get, on OB, we would get a lot of young girls who would come in that were septic because they had tried to induce abortions. And the OB residents used to refer to that ward as dirty OB, because all of the patients on that ward, young girls, 12, 13, 14 years old, came in with septic abortions. And there were the 3 school services that were on the service. They had Howard University, Georgetown University, and George Washington University. Well, Georgetown, as you recall, is a Catholic institution. So they would not allow their students to rotate on labor and delivery because they didn't want them to have anything to do with any abortions, any DNCs dealing with abortions. So it was just Howard and George Washington that rotated on the labor and delivery. But those types of experiences in which you see these young people coming in very septic, and some of them would actually die. And so those are the types of experiences that we had rotating at DC General that stick out in your mind.
You
So
came here for your internship?
I did. I was here for an internship, and at that time, we say Duke and affiliated hospitals because we spent time at Lincoln Hospital. And Lincoln Hospital no longer exists, I'm told, but it's a clinic now, I think. But at that time, it was the main hospital for African Americans in Durham. It was not easy for African Americans to be admitted to Duke Hospital. As a matter of fact, as we were walking down the corridor, this is the old hospital, this part.
That's correct.
Where are the wards? There used to be long ward and...
Those are clinics upstairs. It's hard to decipher because of the remodeling, because when I was a medical student...
I didn't see anything that looked familiar.
I know. They did effective jobs remodeling.
Because long ward was the ward for black males. And then I don't remember what the female ward was, but at that time, the wards were still segregated. When I came as a medical student, they had been more or less integrated, but not truly. This was in 1969, 70. Okay, what year did you finish?
I finished in 73.
Okay, all right. So I did come back here for internship, and one of my attendants that we always considered a doctor's doctor was Dr. Michael McLeod. One of your gastroenterologists, now retired, I'm told. I haven't seen him in many years.
Yeah, we'll plan to have you guys meet up this afternoon.
Okay. But he was just so impressive, and he reminded me a lot of Dr. Henry in that his easy way of teaching you without embarrassing you, even when you had done something that perhaps should not have been done, but he was very good and an excellent teacher.
It was my pleasure to work with him as a colleague for a number of years, almost 20 years.
Oh,
about
really?
20 years, yes. He was still practicing when I got here, and he retired about 15 years ago almost.
That long?
Yeah.
No kidding.
He is about 80 now. So,
Is that right?
yeah.
Oh, so he's older than I am.
Oh, yes, indeed.
Okay. So I came here for the internship, and then after meeting Dr. Henry, I went back to Howard, and the retirement age here, I think, is 65. Is that correct?
70 now, but I don't know what it was back then.
I think it was 65. I think
probably.
Dr. Stead had them to leave at 65. Speaking of Dr. Stead, I'm reminded of the fact that Duke used to have great grand rounds.
Yes, indeed. Still do.
Do they still? Okay.
Yeah.
And Dr. Stead was always at grand rounds. And at that time, the auditorium where they had grand rounds, Dr. Stead would always sit down front in the first seat, the aisle seat. And it's like everybody was afraid of Dr. Stead. If they had to present a patient, it was almost like you could see them trying to hold the tremors. And they also used to bring the patient to grand rounds. They still do that?
No, very seldom.
Okay.
Sometimes
of course, with the
there's a
patient's
video,
permission.
Yeah, right.
Yeah, they used to bring the patient to grand rounds. And Dr. Stead would always have some very pertinent questions to ask. But I remember one case in which they presented a patient with Sydenham's chorea. Have you ever seen Sydenham's chorea?
Once.
Well, that was the only time that I had ever seen Sydenham's chorea, but they brought this patient there, and it was just so impressive. Those are things that stick out in your mind, you just never forget. But Dr. Stead ran a very tight ship, and we were talking earlier about rectal exams. I recall one story they used to always tell in which an intern had evaluated a patient and had not done a rectal. And they said that the patient was from Burlington, North Carolina, and that Dr. Stead sent him out to the patient's home in Burlington to make him do the rectal exam.
Oh my goodness.
So he was a very impressive person.
What was your training in GI like here at that time?
Well, GI did not. I was talking with the administrator. She said you all have about 85 people on the faculty in GI when you include Briar Creek and all those.
Everybody's full-time faculty, so the faculty and mid-levels.
Really?
Yeah.
I was shocked. I think we might have had maybe 10 or 12 people on the faculty at that time. And as a fellow, I spent a lot of time at the VA hospital, which also, as we drove in, I noticed is very different, doesn't look like the same place. But the scopes are so different from what they used to be back at that time. At that time, Olympus was just coming on the scene. And to do an esophagoscopy, we had a rigid scope. I don't know if you've ever even seen it.
I've seen it, but I've never done it.
You had to put your fingers, I thought I was going to lose these two fingers. You had to put your finger around that rigid pipe, and it had a magnifying glass on the end. So you had to, the patients were not fully sedated. So you had to pass that rigid pipe with the patient's chin on his chest. You had someone holding the head, and then you walked them around. You walked around to advance that scope straight down into the esophagus, and the patient's constantly biting your fingers.
Oh, Lord.
So we were very happy when Olympus made an esophagoscope, because we no longer had to use that rigid scope. But as companies do, they made esophagoscope that would only visualize the esophagus. So when you pass the esophagoscope, you could only see the esophagus. But when you got to the GE junction, you could not see much of the stomach. So then they made a gastroscope. And the gastroscope was side viewing, so you could not see the esophagus as you moved down into the stomach. Now, when you got into the stomach, you had a beautiful view. It was, oh, there's the fundus, beautiful view of the stomach. So you had to pass the esophagoscope, and then you passed the side viewing gastroscope. But the gastroscope was not long enough to go into the duodenum. So, these companies were making sure that they kept their business going. So they did the esophagoscope, which sold very well, then the side viewing gastroscope, and then, lo and behold, they made an esophago-gastro-duodenoscope. And then we could see the esophagus, the stomach, and the duodenum. So that was all going on at the time that I was finishing up my GI training. Now, with the colonoscopes were just getting to be fairly good, because initially it was just a sigmoidoscope, and we had done the 25 centimeter rigid sigmoidoscope, but when they did the flexible scope, then we could get into the descending colon, but that's as far as it would go. So then they made a scope that went into the transverse colon, a little bit longer, so you could see about half the colon. And then they made a scope that moved all the way around to the cecum. But there were not a lot of things you could do. When you passed the scope, you could do a biopsy, but they had not done the cautery and all those types of things. So if you had someone with angiodysplasia or polyps, or we didn't even have the snares to pass through and remove the polyps at that time, right before I was finishing up my training. So when I got to Howard University, we were starting to get the what we considered excellent olymposcopes that would allow you to do polypectomies and all those types of things.
How were you received here at Duke when you were training here? I mean, what was the environment like? We crossed some at the same time.
Most people were courteous. There were, of course, I don't know if you remember Dr. Julian Ruffin.
Yes.
Dr. Ruffin was chief of GI here for many, many years, and he was well known internationally. He had one of the largest inflammatory bowel disease populations probably in the world. Dr. Ruffin would not allow me to see his patients. So Dr. Tyre had told me before I came that I would not be able to see him. So I said, well, that's no problem. I thought I would have enough to do that it wouldn't make that much difference. And that's the way I felt, because Duke was always so busy in the VA. So I felt like I still got probably more training than some of the other fellows, because when I rotated at the VA, I was the only person there. And so I was doing everything. There was in endocrinology, there was an intern who later went into endocrinology. I can't think of his name, but I've seen his name on many of the internal medicine, American College of Physicians programs. So when he left here, he did endocrinology, and he's apparently made quite a name for himself. But he was an intern, and he was very aggressive. So whenever those GI bleeders came in, he would call me. And of course, I would be right there, and the surgeons were very anxious to operate, much more so than they are now. And of course, we saw a lot more peptic ulcer disease with bleeding than we did. So we would scope them immediately, and the surgeons would be standing over my shoulder like, why is she wasting time? With this patient's bleeding, we need to take them to surgery. But there was one surgeon, I think his name was Dr. Porter, who seemed very rigid, and I was thinking that maybe he's a bit prejudiced. But we got to be good colleagues, so that whenever they would get somebody in on the surgery ward, he would call me and ask me if I wanted to scope them before they took them to surgery. So we developed a good relationship, and I think I saw a good variety of people, and I also rotated on they had just opened up that research unit.
Yes.
And Dr. Tyre had
Rankin Ward.
Right. Dr. Tyre had asked me if I would like to rotate over there for a while, and of course, you know, you get very unusual cases admitted over there. So I enjoyed that, and I had a research project dealing with bile acid metabolism.
Dr. Tyre.
Yep, Dr. Tyre got me into that, but then Dr. Tyre left and went to Arizona for I think maybe a year or two. He was away from Duke as a visiting professor. But I continued that research, and I was very pleased when my paper was selected for presentation at the Southern Society of Investigation, which was like the research society in the country. And so my paper was selected for presentation in New Orleans.
Oh, wow.
Yeah,
mine was too, some
Really?
years later.
Yeah. I was very proud of that. Yeah.
Yeah, that is it. That's
Because you
amazing.
didn't see any African Americans
were
on
not.
that program.
I was the only one.
Were you the only one?
Yeah.
Okay. I was the only one. But I was very proud of that.
Yeah, they may
So,
have wondered what the
Yeah.
African American women at Duke were doing, how they were so successful. Yes,
Yeah.
yes.
So I was very proud of that.
Were you able to carry on your research at all later on?
Well, when I got to Howard, they needed clinical people so badly that I tried to do research, and I tried to finish up some things that I started here. And the first problem I was having was space. So in the medical school, one of the professors in microbiology says, well, I know you're not going to find this space, but I have a dark room that we haven't been using. So I said, let me see it. And the dust in there was this thick. I said, I'll clean it up. So he let me use that dark room, and I was actually financing myself. My bile acid metabolism was on rats, so I ordered rats, and the people in Howard has a school of veterinary medicine, so they took care of my rats for me, and whenever I needed them for a research project, they would bring them over, and so I did that for a while, but the clinical got to be a bit too much, so I didn't. I think I only did that for a couple of years.
Yeah. I had a similar experience at the University of Michigan trying to do clinical and research when the clinical needs were so great. Have you been back to Duke since to visit since you finished your training?
I have only been here to visit relatives who were hospitalized here, but I think I don't think I've been here like a visit like this where I've had an opportunity to see the institution, to see all the changes. Of course, whenever I was home for the Christmas holidays, I saw the picture of the chapel on one of these walls. And every year I used to, when I was nearby, I would always go hear Handel's Messiah in the chapel, because I always thought that was the most beautiful chapel, and the choir was outstanding. So I would come at Christmas when I would visiting relatives up in the big city of Reedsville. I would come down to that, but I don't think I've done I can't recall doing a tour at Duke in many, many years.
Now, we were talking earlier, and we were talking about Dr. Berry, and then we were also saying that they called him the father of African Americans in GI, and we called you the mother.
Right. One of my chief at Howard was really trying to find a way to rub me the wrong way, because Dr. Berry was much, much older than we were, and Dr. Berry was probably the first African American gastroenterologist
That's
in
what
the
I
country.
understand.
Yeah. So we had started this organization of gastroenterologists, pharmacists, and I think we might have had a few nurses. in which professionals that interested in GI, physician assistants. So we started this organization and we called it the Berry Society.
Yes, I would go to those meetings at
Initially we had, I think we probably had about 75, 80 people. We would meet at the same time as the American Gastroenterology Association meeting. And we tried to keep it going for many, many years. And Dr. Berry also was pushing us to keep it going. And of course, Dr. Berry died, I guess, probably about 20 years ago, but he wanted us to keep it going. So I was president of the Berry Society for a couple of years, and during my tenure, I got an attorney to incorporate us because I wanted Dr. Berry to know that we were serious about keeping this society with his name going. So we got it incorporated, so the Leonidas Berry Society is still in existence. And I don't think some of the younger people, as they came on, they thought the older people were trying to do too much. So we let them have it, and it's almost defunct.
Yes, I think the last president was someone in Atlanta, as I recall, and they had an administrator, but it's been a few years. I think that the diversity committees and the committees on underrepresented minorities at the various societies sort of took over some of the activities and the discussions of underrepresented minorities in gastroenterology.
I don't even see them listed anymore.
The Berry Society. Right. No, I don't.
Yeah.
And but the underrepresented minority groups at DDW have been very good with symposia. They had a couple of symposia this year, and then receptions. And it's not just, it's the 4 societies together doing it, not just one society.
And you were on the program this year, weren't you?
Yeah.
And what was your?
I just was commenting on. Last year I was on the program. This year I wasn't. But several of our people have been. Dr. Julius Wilder is one of our African American gastroenterologists here who is from Maryland, actually, but is an MD, PhD at Duke Med, Duke trained, and trained also in transplant hepatology.
Oh, really?
And is on faculty. He just got a Career Development Award from the ASLD.
Oh, really?
Yes, indeed. And
those are very difficult to get.
And then there's also Dr. McLeod has been impressive in his endowment efforts here in gastroenterology. So yesterday, Dr. Wilder and one of our other junior faculty, Dr. Kappas, received the Tyre Award. So it's a research award named for Dr. Tyre that got started with Dr. McLeod, Dr. Little in I think 1990, and so it's endowed to give a sizable sum toward their
very good.
Yeah. So and there's also the Killenberg McLeod Award to faculty for junior faculty, typically or newish faculty, for teaching, and you'll see I'll show you the plaque out there. So it's been pretty impressive, you know, in a part. And one of the interesting things, Dr. Muir has tried to make our junior faculty aware of the history of GI here, the rich history, and it's been
That's
pretty
very
impressive.
good.
So Dr. Tyre, and this is the Tyre conference room.
Yes, I noticed it.
And his picture's
the
back
photo,
there.
and I see a little more hair.
Yes, so so Tyre, Killenberg, and McLeod are all honored by both teaching awards, and all of them come with a monetary component.
Oh, good.
The Tyre Research Award is quite sizable. It's
Really?
$25,000.
How much?
$25,000.
Oh, that's good.
And
That'll get you started.
Yeah, there's one every year. And this year we actually have 2 people getting it because they had some additional funds. But yes.
So they get it for 1 year, it's assigned for 1 year? Okay, all right.
As usually it's in addition to other funding, because Dr. Kappas has funding from an R01. Both Kappas and Wilder are trainees from our transplant hepatology, our program, but they're both very interested in research in hepatology patients. So it's most of the grants in the past have gone. You'll meet some of the other awardees. Dr. Carla Brady is one of the prior awardees, Dr. Cindy Moreland, and all of them have been, those four are all involved with hepatology and the programs. And we'll talk about some of the programs. You're going to meet some of the fellows, and you're going to meet a sizable percentage of the faculty at dinner, women and underrepresented minorities at dinner. So get a chance to talk about some
Dr.
of the research.
Killenberg came just before I was getting ready to leave, but he was a very impressive person.
Indeed, when I got here, it's still carrying on some of the research in liver and bile acids. Dr. Leon Lack, you may recall, he just
he was
died
working with us on our bile acid metabolism.
Right. Yes, he just died recently, and then
he was pharmacology.
Yes, and Dr. Corford was at the VA. I don't know if you ever.
I remember Steve Corford.
Right,
he was there when I was rotating.
Right. So you and I.
Is he still there?
No. The VA has been impressive in its work with both basic research and liver and pancreas, and then also in hepatitis C.
Oh,
and
really?
They have one of the best eradication rates, cure rates in the country for the VA system. Yes.
Very good.
And I'm not sure you will meet Dr. Steve Choi, who has shepherded that program, is now the division chief over at the VA. So your VA is doing awesome things.
No kidding.
Yes.
All
And
right.
both of my daughters are faculty based at the VA, as well as my son-in-law, but they're in psychiatry. Not in
Psychiatry?
GI. Yeah, not GI.
Okay, not GI.
Yeah.
You tried.
Yes. Now, what about some of your trainees from Howard? How have you? I know that you've mentored a number, and I've known some of them.
Of course, we had a very limited number of people each year. We would only have 2 to 3 in our program, and they've done quite well. We have, I think, 4 trainees who are affiliated with Morehouse University down in Atlanta. So they are continuing with their academic. I think they also doing some private practice, but they are still interested in academic medicine. And we have a young lady who was very interested in liver research, who was affiliated with Baylor, and I think she's still at Baylor. So some of our trainees, of course, when people come to DC, they want to stay in DC. So many of them are still in the DC area, but what they're doing mostly is private practice. And we could have a private practice at Howard, but you had to have it in the hospital.
Right.
And that was because some of the people that were in private practice in the various subspecialties would pick up their check at Howard, but they were out in the city doing private practice. So they made it so that we had to, we could have a private practice, but it had to be at the university, which was fine with me.
Right. That's obviously the model we have here with the private diagnostic clinic. And so, I know we will be having Dr. Charles Howell come as a visiting professor later in the year.
Oh, really?
Yes.
I met Dr. Howell at one of the DDW meetings when he was a fellow. I think he trained in Colorado. And so I've known him for many years. And I know when he left Colorado and he went to the University of Maryland.
Right.
And then I think maybe 6 or 7 years ago, he left the University of Maryland to go to Howard to be the chief of medicine.
Right, exactly.
And
Yeah.
but I don't know how much research he was interested in liver also.
Right. Yeah, he was quite active in liver research. Do you have any words for our GI people here, based on your long experience? is now approaching, what, 45 years maybe?
Yes, and I can still walk. Well, I think there are many things that that are obstacles, but you have to just barrel over them and just keep on pushing, you know.
Mhm.
And I think it's important for people to recognize the fact that you can't just read about diseases. You still need to see patients and put your hands on.
Mhm.
You know, I think that's still very important. The patient that you and I were talking about recent,
Mhm.
who's hospitalized here, he was very disgusted with the patient care. I would like for them to always remember that the patient is foremost, and I would like for them to always enjoy the art of medicine, which is not just reading about medical diseases, but also hands-on patient care, because that lets the patient know that you really are concerned about them. And I think even little things can mean a lot to patients, because when I was still practicing, I decided to start sending my patients Christmas cards every year. And so I bought beautiful Christmas cards, not roses, 5 and dime type Christmas cards, but beautiful Christmas cards. And I got some of the secretaries who were very delighted to help me to address them and send them to the patients. And many of the patients called me and said, I received a Christmas card from you, and it's a beautiful card. And it was just like they were just so touched that the doctor would think enough to send them a personal Christmas card. So I started doing that every year, and it's just little things like that that patients really do appreciate, because that way they see that you are concerned about them. So I think in being concerned about the patients, you really enjoy the art of medicine, which is not just reading about it, but hands-on patient care.
And then now you retired from Howard, and you've taken on another full-time job for now how many years?
It's about 7 or 8 years
At
Central Regional Hospital in Butner,
mm-hmm.
which I was not familiar with, although I grew up in North Carolina. Mm-hmm. And I traveled 85, but I had not really paid much attention to Butner.
Mm-hmm.
But after I retired from Howard, I wanted to keep busy. You know, I think it's good for people to stay active. And a company called and asked if I could come down to Dorothea Dix, which was in Raleigh, psychiatric hospital, for 4 months. And I said, well, this is good. You know, I didn't want any full-time employment. I had just retired. So I said, okay, I'll go for 4 months. So I came to Raleigh for 4 months, and then they said, can you stay another 4 months and another 4 months? And then last year, year before last, I got a 5-year certificate. So I said, well, I guess I've been here a little longer than 4 months.
Yes, and you and other colleagues who have been retired have given incredible care to patients who have a hard time getting their general care.
Yeah, we don't do right by mentally ill people, and mm-hmm. that's not just North Carolina, that's all over the country.
Mm-hmm. Well, my daughters would support you there, and
they're both in psychiatry?
One is a psychiatrist, medical MD psychiatrist from Duke, and the other is a PhD clinical psychologist, also trained at Duke.
So they know what I'm talking
about.
Yeah,
they know what you're talking about. And the youngest is doing, has a Career Development Award through the VA to do research on mental illness, PTSD,
great.
and
That's
HIV.
Great. Is that the one that rotated at Central Regional?
No, the MD one rotated at Central
Okay.
Regional, yeah. And she's worked here at Duke and the VA,
mm-hmm.
And my son-in-law is a PhD research psychologist at the VA. And
mm-hmm.
they're all working on major illnesses that we see, PTSD and the impact.
Oh, really?
Yeah. Mm-hmm. Yeah.
Oh, that's great.
And so it's been great. So they're not GI, but they're your second specialty. Well, an internist. I think that I appreciate your comments about the keeping involved and keeping your hands on patients and not just. And our GI people frequently get incredible compliments for their medical care, the art of medicine. That's because we have to do procedures that people don't normally like.
Absolutely, especially colonoscopy.
Right. Yes. Any further comments?
No, and over the years, it's been a pleasure knowing you, and I've followed your career.
Well, thank you.
And I've been very impressed. I remember when you left Michigan and came to Duke. I was not too surprised. I said, well, she's going back to her roots.
Right. Yes, it's been wonderful. There'll be a family reunion here in Durham. They're having it here for my maternal grandmother's family, the Watkins, and there'll probably be 600 plus people, if not more. Yeah. I think I was telling you my grandmother was one of 12, and then she had 10 kids. Many of her siblings had a lot of kids, and
wow,
I'm one of 7. So the numbers keep
the
multiplying.
name going. Huh?
Yes. Great. Well, super.